My name is Dr. Kailash Mantry. I am a life coach and a mental health consultant. For the last 25 years, we have been researching on mental illnesses and we have been successful in curing all of them. Serious diseases like schizophrenia, bipolar, autism, ADHD, and minor diseases like depression, insomnia, anxiety, Parkinson, Alzheimer, etc. All these diseases, the root cause are always psychological and emotional, and rarely it is physical. Today we'll be talking on Alzheimer, which is also popularly known as dementia. The word Alzheimer was given in 1906 when one neurologist, Dr. Alzheimer, researched on this disease, and this disease is named after this doctor. Now let's understand why one gets Alzheimer or dementia. First is sedentary lifestyle, not much of exercise if the person does in his young time, smoking, alcohol, depression, poor education, high stress level, introvert nature, doubting nature, negative thinker, excessive fear, excessive sadness, excessive worry, excessive doubt. One could say that if you got Alzheimer, that means you have done PhD in negativity. It's not easy to get this disease. People who are negative, fearful for more than 20 years consistently are the people who get this disease. Above the age of 65, more than 10% people are suffering from this disease, Alzheimer. Above the age of 80, more than 50% people are suffering from this disease called Alzheimer or dementia. The root cause of this disease is psychological, emotional, or I would say negative mindset. We have developed a very transparent test, and within 15 to 20 minutes, the patient can be convinced that he is negative. The test is given by the patient only, and he himself answers the 500 questions, and then our job is to remove the negativity from his mind one by one. In a computer age, we can also say people whose hard disk are full and there are viruses in the software, that means in their mind, and the name of the viruses are fear, anger, seriousness, excessive thinking, stress, tension, negative approach, and there are more than 50. Lack of confidence, and there are more than 50. The main symptom of these patients are loss of memory, irritation, sadness, negative approach, fearful person, overthinker, poor judgment, whimsical mood and personality, stubborn, person who has got lots of incompletions, difficulty in walking, in thinking, in completing tasks. They have challenges in planning and solving problems. They have confusion with time and place. These people suffer from vitamin D and B12 also, but that is not the cause of Alzheimer. Now let's talk about the myth about Alzheimer. Although this disease was discovered and named after a neurologist, but the latest research says it is not a neurological problem. It is not a hereditary problem. It is not a genetic problem. It is not a gender specific. Men and women both who are overthinkers and who have negative approach does suffer from the disease Alzheimer. Less than 10% people below the age of 65 or 60 are also suffering from Alzheimer, and this disease is fast increasing. In Western countries where the average age of people is more, these are the people who suffer more. They always need a helper, and whenever they go out, there are more chances that they may not come back home and may get lost. They forget to remember their names also, their residence address also, and these people very often have an accidental death because their balance has also disturbed and the memory loss, and they also suffer from memory loss. These people over the period become arrogant, aggressive, and are suicidal also. They are not able to communicate their feelings with people because basically they are introvert in nature, and they carry negative feelings about all their family members. They experience that nobody loves them and lead a lonely life. There are many conflicts in their family, arguments, aggression, etc. Their behavior is very often self-injurious, and they are fed up with life. They have very poor balance while walking, cannot do their daily routine work, and they don't remember something of 1 hour past also, 1 hour back what has happened. But very often they have old memories and they tend to forget the recent ones. They have difficulties in chewing food also. Now let's discuss the facts. Alzheimer's disease is the sixth largest reason for death in America. More than 20 million people are providing free cares for the Alzheimer patients in America. Alzheimer care centers are opening all over the world because it is difficult for them to stay at home when the family members go out for work. 1 in 3 senior people die out of Alzheimer or dementia. Only 16% of the people are recognized of the disease called Alzheimer, and rest go undetected. As per WHO, that is World Health Organization, the estimates are that more than 5 crore people suffer from the disease called Alzheimer or dementia. One of the common features of dementia patient is they don't accept their mistakes and constantly blame others for their suffering. And now the good news, this disease is 100% curable if the age is below 60, more than 70% curable if the age is below 65, and more than 50% benefits can be given to people who are under the age of 75. The only condition for our treatment is, are they able to listen to us, and if their hearing skills is damaged, then nothing can be done. We are 100% confident that Alzheimer patients can benefit through our treatment, and now we have started online treatment also, and the response is very encouraging. But if the patient come to our center, the progress is more, because we need to repeat very often because of their listening corruptions. Within 3 to 6 months, this disease is curable if the person comes to our center at least for 1 month, and the rest treatment can be done online. Within 1 month, some patients' recovery is more than 40%. And now let's discuss the home remedies. What a patient need to do if he has got this disease. First is, the patient has to accept that there is some memory loss, and then he need to start enjoying life. He should enjoy laughter. He should watch laughter movies. He should educate himself more about life. He should take maximum rest. Should avoid any hard work. Should avoid any major responsibilities. He should enjoy proper sleep, eat healthy food, and at a regular interval. Now let's talk about the role of medicines. Normally 2 types of medicines are given to these patients. One in the morning, one in the late evening. In the morning, the medicine is given to increase his activities, and in the night, tablets are given to slow down. Both these medicines are not of any use, and the earlier he stops is better. In fact, when the patient comes to us, we stop these medicines within 10 days, because medicine has got no role to play in this disease. Neither allopathy, nor homeopathy, nor Ayurveda, or any other pity. He need to only enjoy life. He need to laugh. So once again I repeat, it is a mental illness. It is a mental breakdown. It is a psychological or emotional stress, and it takes minimum 20 years to get into this disease. But it takes 3 to 6 months only to make him recover more than 60%. My name is Dr. Kailash Mantry. I am a life coach and a mental health consultant, and a pioneer in mental treatments of any serious illness also. Thank you for watching this video.